Netherlands, supermutant HIV strain discovered. In the Netherlands, a new highly transmissible and dangerous HIV strain has been discovered, confirming scientists' greatest fears. After evaluating more than 6,700 positive samples, an international joint investigation led by researchers from the University of Oxford's Big Data Institute found 109 occurrences of the novel virulent subtype B, VB, variant. The study discovered significant variations in the genomes of the VB strain and other HIV variants. People who had the VB variation had a viral load, the amount of virus in their blood, that was 3.5 to 5.5 times higher, the researchers noted. Their findings were reported in the scientific journal Science. In persons with the VB variation, the rate of CD4 cell decline, which is a hallmark of immune system damage caused by HIV, occurred twice as fast, placing them at risk of acquiring AIDS much more quickly, according to the study. Patients who were infected with the VB strain had a higher chance of spreading the virus to others. These findings back up long-held fears that new changes in the HIV-1 virus could make it much more contagious and lethal. AIDS now affects 38 million people globally, according to the joint United Nations Programme on HIV/AIDS, and 36 million people have died from AIDS-related illnesses since the epidemic began in the early 1980s. The number of VB cases that have been found is minimal, but the true number is likely to be much larger. Importantly, individuals with the VB variant showed similar immune system recovery and survival after starting therapy as people with other HIV variants, the study concludes. Another piece of good news is that, according to researchers, the VB variant's expansion has been declining since roughly 2010, following the strain's introduction in the late 1980s and 1990s, and its more rapid growth in the 2000s. However, because a new strain causes a faster loss of immune system defenses, it is crucial that individuals are recognized early and treated as soon as possible, according to the researchers, who also stress the significance of frequent testing for at-risk individuals. Because the VB version has so many mutations, more research could help uncover novel targets for next-generation antiretroviral medicines, according to the researchers.
Happening at Stanford, medical researchers there are working to unlock key mysteries on how Omicron came to be and why it's spreading so fast around the world. They also may have found a key to slowing it down thanks to lessons from the HIV pandemic. Here's NBC Bay Area's Robert Honda.
Well, here at the Santa Clara County Public Health Department, the health officer says she's intrigued by these findings, and so are other medical experts. The newest COVID-19 variant, Omicron, is the one to watch right now. Scientists have speculated that of all the other unnamed variants, Omicron evolved faster and with more mutations because it likely originated in someone with a compromised immune system, potentially someone with HIV. Stanford researchers, including Dr. Seth Hoffman, agree after finding similar evidence when treating a patient with uncontrolled HIV who contracted COVID several months ago.
She developed those mutations within a short time span, 15 days, where her immune system was not working properly to evade or control the COVID infection.
Dr. Hoffman says the HIV patient is an example of how someone with an already compromised immune system could spread a mutated form of COVID rapidly in public if she had not been isolated. But he says the most significant finding is that the patient responded so well to readily available AIDS treatment, and that allowed her to fight off the virus quickly, meaning battling the HIV pandemic could be key to slowing the COVID pandemic.
That treatment is so effective today all over the world that we can actually stop their infections in the track and reduce the chance for spreading any sort of new variants.
The Stanford discovery was applauded by Dr. Peter Chin Hung of UCSF. He echoed Dr. Hoffman's sentiments that the message here is not to stigmatize HIV patients or anyone with compromised systems, such as those with cancer or awaiting transplants, but to make sure we're doing all we can to get them treatment.
We're not really sure where these variants emerged, but it does make a good case for really being comprehensive in taking care of everyone's health.
Both experts also reiterated the need for getting vaccinated to protect the one getting the shot and hopefully reduce transmission to those with compromised immune systems who develop those prolonged infections.
So there's a term that they have been mentioning a lot lately, and I wanted to talk about it. An HIV super strain. It's kind of everywhere you go with commercials and ads, and it's just a reassurance of being able to live with HIV for me. So they're calling this the VB variant, and it's just strange. And then they said that Omicron was discovered in an HIV positive African woman that was not on any antivirals at the time, which then allowed the virus to mutate in her system, and it was easily for her to get it. But what I find very interesting is that they're saying that they can't spread it. And here's something else that we've been saying for a very long time. So scientists are scratching their head because they can't figure out why everyone's immune system has been compromised. They blame diabetes, cancer, hunger, and autoimmune diseases, chronic TB, obesity, etc.
BNN.